And we are live.
So good evening. I'm Gale Brewer, Manhattan Borough President, and I am extremely honored to be joining the Columbia University Mailman School of Public Health to talk about food during this pandemic, but just generally the amazing work that these individuals contribute towards feeding New Yorkers now, in the past, and in the future. I have to say these are really busy people, and I am extremely honored that they took time to join us. So I'm going to just do quickly some bios, and then we're going to start our conversation. This is a very special evening. So our first speaker is Mark Bittman, Columbia Mailman, as I indicated, lecturer and former New York Times columnist. As you can imagine, he's a food writer, a journalist. He's written 16 books, How to Cook Everything, one of his bestsellers. He was an opinions columnist for the New York Times, a food columnist for the dining section, and the lead food writer for the magazine. The Minimalist was a New York Times column that ran for 13 years. He's a regular guest on the Today Show on NBC and on National Public Radio. He's been on the Food Network, and he is beloved by anybody who's a foodie, but just in general, all of us. So without further ado, Mark, if you want to join us and just talk a little bit about what you think is going on both as a lecturer, New York Times and other columnists. These are really challenging times in terms of food, so I'd love to have you say some introductory remarks. Thank you for joining us, because I know you're really busy.
It's great to be here, thank you. I won't talk too much about local issues because we have so many experts on the city here right now. So I just want to say, that what COVID has done has laid the food system bare, and that all the subsidies that have been used to grow corn and other commodity crops have done little to actually feed people who need it, and that's what we're seeing. So we have a public health crisis of actually feeding people on top of a public health crisis that is the result of malnourishment and chronic disease that comes from diet that's been brewing for years. And that's also thanks to our flawed agricultural system. And that's all on top of the COVID-19 crisis. It's worse than that, because the people who are suffering most are the people who always suffer most. And I'm sure we'll get into this, but I want to say just up front that without a food system that is geared toward protecting the land and towards supporting real farmers, and a regional food system which is resilient and would not break down, as we're seeing our national food system break down now, we just can't have a food system that feeds us all well. And I'm sure we'll get into this, and I don't want to take more time than that.
Thank you very much. Our next guest is Kathleen Garcia, she has many jobs. We know her as the Commissioner of Sanitation for the City of New York, but she has also been in the past head of lead for the New York City Housing Authority. In fact, she's still vice chair on NYCHA's board of directors. From February until July of 2019, she was even the interim chair of that agency. She is an amazingly good operation manager, and I think that's why she was called upon by the mayor to work to try to address the lead challenge of NYCHA. That was in October of 2018 when she took that job. Now, in March of 2020, Mayor de Blasio named her, during this god-awful COVID-19 crisis, food czar to the 5 boroughs. And I have to tell you, as somebody who started really worrying about the seniors and food, we've had nothing but a wonderful experience working with Commissioner Garcia. She's a lifelong New Yorker. She's from Brooklyn, as she reminds me, at every possible opportunity. In the past, she had jobs at the New York City Department of Environmental Protection, where she was ultimately appointed Chief Operating Officer, working a lot on the operation of our water supply. So really, there couldn't be a better person to be here tonight to talk about the issue of food and all of the food supply issues and how she's addressing making sure, and she is, that every New Yorker does not go hungry. Commissioner Garcia, thank you very much for joining us.
Thank you so much, Borough President.
So yes, this is a really unbelievable task that we have set before us to make sure that no New Yorker goes hungry in this particularly dire time during COVID. And the need is just mammoth. And what we are seeing is that both with the virus, but also with the fact that the economy has struggled so much and continues to struggle and probably will for a while, that people were very close to the edge, and that we had many people who were already food insecure. So we today will probably deliver over 1 million meals to people across the 5 boroughs, mainly seniors are a big portion of that, and because we told them to stay sheltered so that they would be safe. In addition, we have school locations across the 5 boroughs where we'll do north of 550,000 meals for people. And we continue to try and find ways to make connections, whether or not that's for the pantry system, which wasn't quite a pantry. It was like several systems that we were trying to organize a little bit more holistically, or the work that we've done with Grow NYC and their pantry boxes, really stepping up to ensure that where there weren't pantries, that we had food for people. So it is really a very broad system, but we also were looking at supply. And as Mark mentioned, the challenge we often have is that 80% of the food that's eaten east of the Mississippi comes from west of the Mississippi, and those are long supply chains. And so we did definitely see some panic buying at the beginning of the pandemic. That has sort of more or less worked itself out at this point in time. But we would have been more resilient if we had been more regional in our focus. And we're trying to think through how we can do that so that when there's the next crisis, we're a little bit better prepared, that we're a little bit more resilient, and that we're also supportive of each other. Upstate farmers, because so much of our food went to restaurants, were unprepared to shift for a retail setting. So there was food coming in. Some companies have made some changes to their business model to make that better, but what you see is that we were not quite prepared for a sudden shift. So on a somewhat light note, apparently COVID has made us an entire city of bakers, because flour was not to be had for a while, because every time I look at anything on social media, people are talking about their sourdough starters. So we may not have had time for that in the past, but definitely looking at doing it now. Thank you.
Thank you very much. That and yeast seem to be a very big commodity. Nate Mook is CEO of the World Central Kitchen. He works hand in hand with the founder, whom we all know, the activist and humanitarian chef Jose Andres. And I want you to know, Nate, that as somebody who did not know you or know your agency, your company before, everybody in every sector of our city is talking very positively about what you're doing. And that's in New York, that's a real accomplishment, because everybody talks nasty about things, but not about your wonderful company. I want you to know that, and that has a lot to do with you. So you oversee the operations, the emergency disaster relief efforts, all the long-term projects. You were part of leading the Chefs Puerto Rico effort in the aftermath of Hurricane Maria, another example of a disaster. Before coming to the World Central Kitchen, you produced the HBO documentary film, Baltimore Rising. You have been a filmmaker, and you've been to different countries around the world where there have been disasters, working on such projects that have helped people. You in 2013, with President Clinton, you traveled throughout Africa, talking about humanitarian aid. And you were earlier in your career an entrepreneur in the technology and software industries. I think all of this has prepared you for dealing with what we're finding ourselves in today. So thank you for joining us. It's a really big deal for me to meet you virtually and to hear what you have to say. Thank you.
Thank you so much, Gail. It really is an honor to be here. And, I think our work in New York City is really a testament to our amazing team that we have on the ground all throughout the city and in all of the boroughs, and also working very closely with the city itself, with Commissioner Garcia's team, and to make sure that our role in some ways is to kind of fill some of the gaps, right? That there's only so much that the city can do on its own, that states can do. And so nonprofits like World Central Kitchen can really play a role coming in and filling some of those gaps and moving very quickly. We've, I guess, had the unfortunate opportunity to be working on this crisis for quite a while. We had a team out in Japan back in February working on the cruise ship that was quarantined out there. So we started to learn and set up systems for how to both prepare food and distribute food in this type of environment, which is very challenging. This COVID disaster is unlike anything that we faced before as a nonprofit that works in disasters, and also unlike anything our country has faced before, because it is not in one specific area. It is not sparing anybody. And I think as the time goes on, we're also seeing how, as the commissioner noted and others have noted, we have gone from a health crisis to an economic crisis that we're now seeing become a humanitarian crisis as families are unable to put food on the table. And it really requires a completely new approach. And this is, World Central Kitchen. We've been adapting from the beginning. We started working in New York in early March to get food out to areas in the Bronx and in Queens and in Harlem. And we've really been focused on how we can continue to serve the communities and reach those that are really struggling right now because of everything that's happening. And so one of the things that we've been doing is looking at how we can activate restaurants in the city, how restaurants who right now are struggling and out of work can be put to work in service of their neighbors and of the communities in which they exist. We have about 125 restaurants now active in New York City. Overall now, World Central Kitchen, we're distributing over 100,000 fresh meals every single day, all throughout the city. And, we're sort of able to bring to bear our expertise and experience, but also really working hand in hand with the community-based organizations, those that are on the ground, the community leaders that can connect us and create that bridge to those that are most in need right now. And so it really is this collective effort, and it's in some ways, inspiring to see the city respond the way that it's responding. And there's still a lot of work to do. I think we're seeing firsthand, in addition to our meal distribution, we're also working distribute fresh produce as well and purchase from New York State agriculture producers. And in places like Queens, we have families that line up for 8 hours and wait for 8 hours in line to know that they can get a bag of food to take home to their families. And I think right now, if that doesn't, highlight the challenge that we're in as a country right now, I mean, I don't know what else does, because this is unlike anything we've ever seen before, and it's really going to take everybody working together to solve this problem. So we're proud to be working side by side with everybody here to do our part.
Thank you very much. From health to food to humanitarian, that sort of says it all. I appreciate that. Our next guest is Marcel Van Ooy, who is president and CEO of Grow NYC. He is a former director of the New York City Council. And I joke because I was a council member and he was in charge literally of the city council when Gifford Miller was the head of the city council as speaker, and he had a lot of power and I was just a council member. So I have not forgotten that. I'm very, very fond, particularly now, of Marcel Van Ooy. He really has taken the issue of what we used to call the green market as one portion of Grow NYC and made it much larger, and under his leadership, it has expanded tremendously with so many new initiatives. Some of them are the Fresh Food Box. It's a weekly affordable food mix for low-income residents with a real focus on trying to make sure low-income New Yorkers get food. There are teen-run farm stands in many communities. And of course, the local food hubs, the green market that we all love so much. And those green markets take food stamps or SNAP, which is again one of his initiatives. In fact, in 2013, and probably even recently a higher number, but the 1 million SNAP sales in that year. He has also participated in education programs such as Grow to Learn NYC Citywide School Gardeners Initiative, and a partnership with the mayor's office to inspire and facilitate school gardens in almost every New York City public school. And needless to say, I'm very fond of this person, and he has really changed the way in which the public sees fresh fruits and vegetables. We work with him all summer for the seniors and all year long with a CSA at 1 Center Street. Thank you very much, Marcel.
Unmute myself. Thank you, Gale, for that wonderful introduction, and great to be here with all these other really accomplished panelists. You know, Grow NYC, you know, we've been working with Gale for years now. In fact, we've taken some trips up to visit farms with a local council member, which we never expected to happen, but borough president now, but Gale has been a real leader on food issues and in the city, and done a terrific job supporting our programs and making sure that everyone in Manhattan and beyond has access to healthy, fresh food. So we also work closely with Commissioner Garcia and her terrific staff on trying to make sure that no New Yorker goes hungry. It's our 50th year at Grow NYC, so it's been, you know, a very odd year to be celebrating 50 years, but we continue to do our work supporting farmers and providing access to healthy, fresh, local produce through our green markets, through our fresh food box programs, through growing on Governor's Island and community gardens, and then also, even though the schools are closed, making sure that our schools can start up hopefully in September with new gardens. So it's been a difficult and challenging year, both from the farmer's perspective and creating access for all New Yorkers. Nate talked a little bit about the lines in Queens. We see that also throughout the 5 boroughs in the emergency food box program that we helped create with the city to deliver farm fresh produce to underserved communities that the commissioner mentioned. We continue to try and make sure that the farmers can stay in business, run our markets under extremely difficult situations. And you see the different now how our green markets have adapted to the new changes of social distancing and limiting access, along with our food box programs. The list goes on and on. So I'm very happy to be here tonight and talk about the challenges that the city faces. Certainly they're not small, but we're willing to play our part in making sure that farmers are supported and New Yorkers have access to produce. So thank you.
Thank you very much. And I think Marcel knows the story, but my grandfather was best friends with a guy named Benepi. And then my father was a good friend, and still my father has passed, but Barry Benepi, I think, is one of the founders of wonderful green market. And I remember his father saying to Barry, I don't know about this market stuff. I think you should get a better job. And Barry Benepi founded it. And of course, if they could all, Barry's still with us, but if they could all still see the great things that Barry did, and the grandfather was wrong. So our next wonderful speaker is Reverend Maurice Winley, who's Executive Director of Living Redemption Youth Opportunity Hub. He's a 3rd-generation minister who carries the legacy of his family. He's been active in youth development for many years, working with youth and families. He is a sought-after consultant on youth initiative with many community-based organizations. Reverend Winley has worked with internationally based organizations such as World Vision, Youth for Christ, Navigators, and many others. He's also a chaplain for St. Christopher's, an adolescent residential treatment facility in Dobbsbury. He currently serves as Director of Operation in the Soul Saving Station Church. It's in Harlem, and he's a board member with Barbara Askins of 125th Street Business Improvement District. And along with many other nonprofit organizations, he launched Arches, a transformative mentoring intervention for young adults on probation in New York City. Arches is part of what Mayor Bloomberg started and Mayor de Blasio has continued, called the Young Men's Initiative. and that is tackling the broad disparities regarding the advancement of Black and Latino young men. And I want to thank you, Reverend, for joining us, and thank you so much for understanding how important this issue is, and the floor is yours.
Thank you for having me, President. So it's good to be here with the panelists. I'm honored and humbled. Again, in the midst of this unprecedented time, Living Redemption was established in 2018. Monies that was seized from HSBC Bank was invested in preventing youth to preventing entering the criminal justice system. This was under the leadership of Manhattan District Attorney Cy Vance. And so prior to the COVID, we engaged up to about close to 500 youth and families, hyper-local demonstration in Western Central Harlem. And in the wake of COVID, our mission is very simple: saving lives, healing communities, one relationship at a time. In the wake of COVID, we've always tried to have a responsive stance in terms of meeting the greatest need and the greatest pain point in the community. And it became abundantly clear that food scarcity, and as many of my colleagues talked about, it's a deeper issue, but in terms of the immediate food needs was a definite pain point. We partnered with the Department of Probation and the Food Bank of New York City in the Harlem Neon Kitchen. For the last 7 weeks, 14 days, we have been able to serve over 11,000 individuals with meals. We created an open air grab and go distribution. It's very compelling to see the need. These are individuals, these are families, these are hardworking people. These are not your typical transient people. These are youth, seniors even, standing, waiting on lines that go all the way around the corner, waiting for food. And so I'm grateful to be a part of this dialogue to talk about sustainable solutions that address the root causes in terms of really developing sustainable, healthy, accessible food delivery for the communities, for those that need it the most. So I'm grateful to be here with everyone today. Looking forward to further conversation. Thank you again.
Thank you very much. So I'm going to start with a local question, but hopefully Mark and Nate and others can make it even broader, because people in New York City were very provincial. So they wanted to know, one of the questions is, what about urban agriculture? What about community gardens? What about empowering local communities on feeding themselves? And I know Harlem Grown, which I'm sure the Reverend knows, tries to do that. And that's a very hyper local question. And I suppose you could broaden it out, because I too am very concerned, as is Marcel and all of you, about the farmers in the state of New York. But I guess start with you, Mark. It's a little bit too local, but I do think it's a question that I don't know that we can answer, but the notion of how can we do more locally is something that people are concerned about. So I wonder if you could start the conversation.
Anything that anyone can do to enhance locally available food is going to be welcome and is going to be helpful. So urban gardens cannot, reasonably be expected to feed a lot of people, but they can show people that regional food is important. I think more important is to continue to fund programs like Nourish New York, and to continue to make SNAP food stamps available to more people at more places, to allow farmers markets everywhere and even CSAs to take SNAP dollars, SNAP cards, so that more and more people can afford and can have access to local and regional food. This is a historically an agriculturally rich region, and there are still farmers here. We're not just talking about New York State. We're talking about 3 or 4 states that can be considered regional, but the Hudson Valley especially. And to the extent that we can encourage farming in those regions and we can get that food into the city, that's really a win-win.
Commissioner, I know that you have to deal not just locally, but figuring out the distribution, figuring out the regional. Is there some way to balance that? I know that as Mark said, the local is not going to feed us, but between all of these mechanisms, is that what we're aiming for? The distribution, the community, and of course the regional? How do they all
So,
fit?
right, no, as I would agree that like community gardens can't feed 8.6 million people, but the region probably could feed a lot of us. And that there would be food enough, not maybe everything, but there would be a lot of food available regionally. But it would also require some things for us to think about differently, which is to eat things that are in season, to be willing to sort of not have strawberries in the middle of December, um, or to focus more on things that are more local. I think that it's a longer term interconnection that I think we need to be much more hyper focused on. I know Grow NYC for years has been supportive of New York State farmers and other regional farmers, but what we saw is that we were vulnerable to things happening elsewhere in the country because of their policy determinations about how they were going to handle the crisis, which is why we saw the challenges at meat processing places, but also to understand how to cook things. I did not know that New Yorkers do not like to cook whole chickens. They only like to cook chicken breasts. Very hard to come by at a certain point during this entire time. So being willing to look at where food is coming from, but I think reinvesting in our regional infrastructure and in making sure that there is food manufacturing closer to the city. One of the things you saw is that local butcher shops that had relationships with farms had no issues whatsoever with supply. But we don't have that many of those anymore. And so we are very dependent, as is the rest of the country, on these very large processing plants. And that is, I think, one of the things, a lesson learned of we don't want to necessarily put all of our eggs, to use a food pun, in one basket.
Perfect. All right, Nate, you have all this wonderfully international experience. I go from the top of Manhattan to the bottom of Manhattan. It's very embarrassing. I have, it's a little parochial, to put it mildly. So from your experience, which is vast in terms of you've seen other very big crises, do you think that this is a winning strategy to try to have more regional? Is that worked elsewhere? And I just would love to have you comment on what it looks like for the future, to try to stay local, but I don't know if it's possible.
Yeah, I think it is, and at least it can be a central part of the solution. But first of all, I do want to say that Manhattan is so incredibly multicultural and that it really does represent a cross section of the world as well. So don't undersell it. No, I think one of the things that really has come out of this crisis is the importance of both local leadership, right? That this pandemic is not going to be solved on the national level. Solutions are going to come from the local level and local leadership. And second, that our approach to solving problems really needs to start, in our own communities. We as a country were not prepared for a national disaster that impacted everywhere. Our institutions like FEMA, or the USDA or other large government agencies that typically could step in and respond can't do so at the scale of the crisis that we're talking about, which means that solutions really need to come from within. And so I think it is critical to start there. It may not be possible to solve all of the problems to feed all of the people, but I think at least looking at what resources you have on the ground is going to be the most efficient. It's going to support those that are already in the community and those that are impacted, and try to keep some of those dollars that too often flow in and then flow out of communities to other places, keep them really in those neighborhoods that need them most right now. One of the things that World Central Kitchen really believes in, and the way that we approach our own work, whether it's in the United States or abroad, is we go in, we don't sort of parachute in from the outside with all of this equipment and solutions and come in and say, we're here to solve your problems. What we do is we say, okay, how can we come in and look at what resources are already there and bring to bear our expertise and experience and uplift and leverage what's already there on the ground to move quickly. In Puerto Rico, for example, why would we be bringing in bread from Miami when we could activate those bakeries in Puerto Rico and get them back up and running, right? It's a similar situation here with this pandemic. As we're looking at food and feeding our communities, trucking in a bunch of processed food all the way across the country is not necessarily the best solution when we have amazing food production, we have restaurants, we have growers, locally. And maybe it's not gonna fix everything, right? But it can at least be a start and the core sort of focus of what we want to do. And for us, this is exactly how we're looking at the problem. So if we need to feed families in Harlem, let's find restaurants that are in Harlem that have been there for 20, 30 years that right now that may not exist in 6 months if we don't find a way to support them. Let's try to identify the community organizations that really have those inroads in to those local places in Queens and support them and uplift their work. So I think that really needs to be the way that we look at this, both from sort of an overarching perspective to how we solve this crisis by going local, but also specifically to food. How can we leverage what's already there? What resources we have? What are the local growers? What are the food production facilities, the restaurants, the caterers, the those that exist within those communities, and then help them to help us.
Okay, Marcel, this is somewhat, what you've been working on since you headed up Grow NYC. These are hard tasks because goodness knows this has been the mantra of your wonderful organization. But I would love you to contribute. The commissioner points out that you really have been working on this and trying to save the farmers. I guess what else needs to be done in the region in order to accomplish what your goal is and what everybody here is talking about?
Well, thank you, Gale. Yeah, we've been working on this issue for decades now, supporting farmers in Hudson Valley and beyond, and more recently on building infrastructure to allow regional growers to support and sell in our markets and through our food hub up in the Bronx. But I think one of the biggest challenges, and I think what we've seen, and I always go back to this kind of larger view, is we've as a government have put millions of dollars in our water supply to protect it, to ensure that it's safe and clean and free for the most part to all New Yorkers. We spend tons of money on our air to make sure it's clean and reduce the impacts from both vehicles and buildings. But we've spent until recently very limited amount of money focusing on our food supply, who's growing it, where it's coming from, with the exception of the subsidies that Mark mentioned, which all go to big ag and end up in high fructose corn syrup and making people sick. So it's heartening to know that people are starting to think about these issues. It's unfortunate that it's taken this crisis to really put a real focus on the need to build out a robust regional infrastructure when it comes to both supporting our farmers growing now and year round, and then providing the the infrastructure that takes to get that product into the city, store it and distribute it in a safe way, which is what we're doing. We're building hopefully going to break ground sometime in June on our large 50,000 square foot food hub in the South Bronx, which has been supported by the governor and the city and a lot of wonderful foundations, including Bank America and others, which will allow us to bring in that regional produce, aggregate it, store it, distribute it to restaurants, to grocery stores, and through our food access programs that I talked a little about earlier. So that I think focus on building out the infrastructure and getting players in the market who have a mission behind them and are interested in actually getting the best food to the communities that need it most are key if we're going to really turn around how we protect both farmers and increase access into low-income communities that need the food the most.
Thank you. Reverend, I know that you work a lot with young people and you work in the community. So I'm wondering, in terms of your work, what would be helpful? I know that there's we're always trying to get jobs in the hospitality industry as an example, and also other ways that you think that food could be an impetus to support the community. I'd love to hear your opinions on that.
Yes, I think that in terms of really creating an ecosystem, you mentioned jobs. I think education is critical. There's a generational issue in terms of addiction to unhealthy foods. And so you have to couple that with education, but also accessibility to those foods, training them how to grow these foods. And so even as I'm listening to the Food Hub, I mean, we're looking at, we have about 147,000 square feet to develop. And so we're looking at how to approach the space in a way that's going to be beneficial. And so I think that education, again, you talked about jobs, there's jobs, the manufacturing, really creating an industry. I'll say this, we have to ensure that what the profit really is the profit the cash, or is the profit to really see people healthy, as to see when we see the profit margin as sustainable, healthy foods in the community that are grown by the community, owned by the community. I think that we have to see that as a profit, really bringing that collective stakeholder to bear. So it's not just the youth, but I think it's just the overall community. I think that many youth are not exposed to it in our communities. You see liquor stores, fast food restaurants. This is the typical what you see. And so imagine if they could get exposed to hydroponics and vegan restaurants, and this whole new way we understand where COVID has left us, even pre-COVID, the health conditions and the preconditions and how prevalent that is. And so I think that a new health consciousness and a sustainable way and an equitable way is essential, and to begin to do that with a multi-pronged approach: education, job immersion, creating a cooperative economic structure, and accessibility, not just in terms of access to food, but accessibility to be able to participate and own and produce.
Thank you. So Mark, there are a lot of questions, as you can imagine, about the issues of what happened at the meat markets, and COVID. And then of course, the question that I know my colleague Adams in Brooklyn loves to have asked, which is, how can we get more plant-based food for New Yorkers? So that's something that, these two parallels are also on the mind that COVID has hit us. I think people, if there's any silver lining, which there isn't, Mark, after 20,000 people in New York have died. But the silver lining is that people are thinking about these things, and hopefully, the idea that Reverend suggested of having, the kinds of restaurants and the lack of fewer fast food and fewer liquor stores will be a wonderful, pleasant surprise for all of us, I think. So I'm wondering, Mark, from your experience, is COVID helping us to think differently about food, hopefully in the future?
No, I don't want to be well, I guess I do want to be the non-local person. I think that I fully support what the Reverend just said about how do we evaluate profits, what is actually good for people, because the stock market and the GDP don't really measure well-being at all, and what we're after, I think, is well-being, and a healthy country, a healthy society. We can do what we can on a local and regional basis, but it's not just COVID that's a national problem, it's agriculture and it's our food system that's a national problem. And we have to look at it both locally, as we have to look at it individually, but we have to look at it nationally also. And as long as our food supply is focusing on food that's unhealthy, profitable for big corporations, but not profitable, as the Reverend says, for people, then we're going to have a food supply that's going to cause disease and it's going to be unsustainable. So while we're working on these alternative food systems locally, while we're supporting local and regional agriculture, while we're figuring out how to help the state get the city the local food that we could so benefit from. We also have to think about where power lies in the country and how to change that. And you know, the elephant in the room is that we have a Congress, or at least a Senate, that's unwilling to consider meaningful change in the way the food system works. And we obviously have a president who's not even willing to consider helping feed people in a time of national need. So change is possible. I think COVID is showing us that. We're not hearing about austerity budgets. We're not hearing as much of the usual neoliberal claptrap about lifting yourself up by your bootstraps. There is some attempt to feed people. There is some attempt to use the public money for public good, but we need to see a lot more of that. And that's got to come, as I said, not only locally, but from national political action.
Okay. So Commissioner, that's a heavy lift because so much of it is out of our control here in the city. But are there ways that we could, I'm always hoping that, you know, governments locally, which if you read some of the literature now, there's a lot of push on the governors and the mayors because of the horrific national situation. So people are looking to local for leadership. So I'm just wondering if there are ways that we could change either our purchasing. I've been talking about this for a long time, as you know, as a city, or are there other ways we could address some of Mark's issues that could be beneficial to our city in terms of our health?
Unmuting now. Sorry about that. I was muted, didn't realize. This all comes down to the choices that we make, what we purchase in the grocery store. You know, if we don't purchase plant-based proteins, nobody's going to send them to us. If we do, then they will supply us very robustly. But if we choose to eat much more processed food, it's very hard for someone to overcome that if those are choices we are making as consumers. The system is designed to make that food the cheapest food, which I think is very unfortunate. So you have healthy food that's feels significantly more expensive than things that are heavily processed, but are obviously subsidized. But I think there still is a lot that state and local government can do to sort of promote healthy eating and promote being able to make some of these connections into the region. But it will not happen if we are not, as consumers, making the changes we need to make in order to move forward.
So how can government promote, obviously with ads, but in terms of our purchasing power? I mean, because as you know, we DCAS, not sanitation and not the food czar, but DCAS does a lot of purchasing as an agency. Are there things that could be done along those lines, or other agencies too, hospitals, et cetera?
Right, and I think actually DOE is the largest feeder in the entire country. But they have really strong relationships with New York Dairy. And if there's a slight percentage that doesn't come from New York State dairy farmers, but it's a very slight percentage. And I think that those relationships are important in order for how government spends their money. But I also think it's things like Grow NYC, which the city and the state have been supportive of for a long time, where they are actually physically making the connection between the upstate, downstate cohorts. So I think there are things we can do policy-wise. And then I think that there is a component about this, which may sound very 1950s of me, but we don't teach anybody how to cook anymore. If you come from a family that doesn't have somebody in it who spends time cooking, we never give anybody sort of the information and data, which they used to do not that long ago. Back when I was in school, we had classes on this that I think were really useful. Like, this is what this means. This is what a nutritional label means. This is what you should think about in terms of food.
Okay, that would certainly help in terms of plant-based for sure. Nate, just in terms of what Mark was talking about, some national challenges we have, and we know this from the president's cut of food stamps and SNAP, and of course, Big Ag and his friends. So again, are there some ways that could be some kind of a food movement, even though people are doing it in different buckets? But I wanted to know if you could respond to some of the things that Mark said.
Yeah, Mark said something at the beginning of this conversation, which I think is so spot on, which is that, COVID has laid our food system bare, right? On one hand, we have lines of cars stretching for miles, people waiting for food. And then on the other hand, we have farmers plowing under, their produce and dairies dumping their milk, right? And I think we're hopefully can use this moment to come to terms with some of that and bring about some change. Now, there are a lot of hurdles, right? As Mark said, it's not as easy as some political will to move things forward. There's a lot of roadblocks along the way. But I think if we can start to get some momentum that we can keep up, and governors and mayors and representatives and senators can continue to push forward, I do think there potentially is a light at the end of the tunnel. Already we are seeing some post-COVID efforts in our federal legislature to push some things forward. World Central Kitchen, we've been involved in supporting an effort to a bipartisan, bicameral effort to enable FEMA dollars in disasters to go back to local restaurants and local farmers, and also to provide states with 100% cost share versus the 75% that typically is allocated, because that hurdle and that cost for a state means that especially in lower income communities and cities and counties, they won't take advantage and be able to feed their citizens. And so that's one piece that we call the FEED Act that we hope can go and continue on. Yesterday, there was a food as medicine bill that's introduced. There's an effort, a number of different food related efforts that are now going through both houses of Congress. So I think we're starting to see the acceptance of the importance of food in our system when things break down. I think we're also starting to see an acceptance, which really is one of those things that you don't really think about until things stop working, which is that schools are the number one place in the country where we're feeding our citizens, right? And if we don't provide the resources to our schools to feed our children properly, then we're going to be burdened with the outcomes of that. A lot of people don't realize that many schools across the country don't even have proper kitchens. What kitchens they have are essentially reheating facilities for processed meals. And so if we're not even cooking for our students, then how do we cook? How do we expect our families to cook and all of these things? So I think we start tackling some of these root issues and use this moment as an opportunity to raise the awareness and the importance of our food system and start to address the sort of fundamental flaws, then hopefully we can come out of this a little bit better than we were before. And there's definitely some signs of progress. USDA recently launched its Farm to Families program, which enabled, they're putting in about $3 billion to buy produce from farmers that then can be distributed by nonprofits and food banks. It's not perfect. There's some problems with it and folks who got government contracts. But I think at least it's a step sort of towards the right direction, an acknowledgement that we need to support our small farmers. We need to enable our nonprofits and our food banks. We need to understand that our system is fragile, and as much as states and cities are going to be able to do on their own, there's a certain point where that breaks down and the federal government is going to have to come in because the scale of the need right now is so massive.
So thank you for that, Nate. So Marcel, obviously, if you talk about schools, you have meatless Mondays, and then Thursday is supposed to be New York State. And we always, despite Kate McKenzie's great efforts as the person in charge of the mayor's food office, we never know how much is from New York State on Thursday. We're always wondering. So the two questions. One is, how do you think the schools could be the instigator, the lever, the initiator that we've been talking about, because we have been trying. And then the second issue is you obviously have, I'm sure, colleagues around the United States doing the amazing similar work. And I'm just wondering, picking up on what Mark's suggestion is, do we have a chance? Nate is very optimistic, thank goodness, but how do we take on this big agriculture? Is there some way that your colleagues around the country have been thinking about that? It's not easy, but they're obviously doing the right thing.
Well, you know, schools in New York City are unique because the meals are, as opposed to many areas in the country where they're doing scratch cooking in the school and they can prepare a meal where they're purchasing local. The majority of our meals are being made in a central location and then distributed to the schools to be reheated. Some of that is changing, which is great. You're seeing more schools bring back kitchens and do scratch cooking. And the Department of Education has been very progressive when it comes to sourcing the product from New York as much as they can. A lot of that problem is that the limitations placed upon them on the amount of money they have for a meal from the federal government. And more increasingly, the limitations that were removed under the Obama administration are now being put back on what they can serve and how they serve it. So, you know, unfortunately, the trend was moving in a good direction, and it's now shifted back when it comes to school meals in New York City. But they have some real challenges feeding, you know, 1 million kids a day. And anyone who can imagine the size and scale of trying to do that, it's pretty incredible that they're able to even pull it off. And for doing it with the, you know, the pennies that they get from the federal government to do so is even more challenging. But slowly there's good change in that direction. You know, nationally, I think the best thing that I've seen from our perspective was actually it's copied all over the country, but it started here in New York City, which is the Health Buck program, which is an incentive on SNAP purchases in farmers markets. Back in the 90s, when SNAP went from paper coupons to the EBT card that people get now, or SNAP card, it wiped out access to fresh produce in farmers markets. And we helped bring that back in New York. And the health department had a program back then where they were giving out incentive coupons for people to purchase at farmers markets. We were able to work with them to marry those two programs, and now that's been copied all over the country. So every $5 that you spend at our market, you get a $2 Health Buck incentive from SNAP, which increases your buying power by 40%, which makes a real difference. The challenge is that SNAP keeps getting cut, and on a national standpoint, and it is probably the best hunger program there is when it comes to actually putting money in people's pockets and allowing them to use that money to purchase from in their local communities. And it should be supported, and everyone should, you know, rally again to tell their Congress people that they want it supported. The incentive program, there's money in a federal budget, not a lot, but each year it increases a little to enhance those programs that add on the buying power to SNAP, which is terrific. And if there's a true vision of where food should go, that's kind of it, which is instead of giving incentives to corn and soybean growers, you're putting money in the pocket of local producers who are growing healthy, fresh produce. People are buying that at a farmer's market or other outlet. They're using that incentive to increase their buying power. So it's a real win, and it's supported on both sides of the aisle. You know, it's the red state, blue state win in the sense that farmers are, you know, who generally live in, you know, the red states or part of the red states, you know, get the money in their pocket from the SNAP incentive, and people in low income communities get access to that really amazing produce. So that is a glimmer of hope. We hope it can continue and grow over time. And then someday people will be complaining to me about the fact that, you know, our green markets are getting massive federal incentives.
Oh boy. Reverend, I think we're all dealing with this horrible pandemic, and I'm wondering, in terms of the people whom you serve, how it has impacted them food-wise. There are lines at grocery stores, and there are lines at the pantries, And, you know, we've been trying in our way with Fresh Direct, but thanks to the commissioner to make sure that those at NYCHA have food, because many of those seniors cannot go out the door, as you know. So I'm just wondering, in terms of some of what you've seen on the ground in terms of this COVID, and what you might see, how it could be used, if at all, positively in the future, in terms of what can we learn from this so we can help the people you are serving.
Yes. I think that what we've seen, I'll start with mobilizing the young people as resources. We often see the youth as participants, but in the wake of COVID, we've been able to, and obviously in abundance of caution and safety, we've been able to see a number of youth being mobilized as community change agents. And I think that that's something that can definitely be pointed to. I think there's a number of new industries. I mean, we're talking in the context of the food industry, and I alluded to that, how we can create career ladders and gateways for the young people, not only from a health education point, I mean, and use them as educators of their peers, use them as content creators and curators to disseminate and produce. In terms of seniors, it's heartbreaking to see a senior waiting on a line, and obviously we expedite service for them. But there's so many seniors that are unprotected, that don't really have an advocate, that don't have someone to accompany them, and so that's just a gap that's glaring. It's glaring in your face. You mentioned already, our colleagues and many have stated, in terms of being able to have access to fresh produce. That's something, and we're grateful for all the resources that we receive, but that's definitely a shortage that I see in the community, of being able to give quality produce. You mentioned the supermarkets. Many of the supermarkets, particularly in Harlem, are small. When you compare them to many supermarkets that exist in the suburb, you have Rite Aids that are larger than some of the supermarkets in the community. And so just that disproportionality, accessibility. So if there's a way to really get some of those products in, because we definitely see the need, and we've devised an approach to deliver it in a way that's very efficient. I mean, those are a few things that I see just from on the ground. I also see that the need is growing from when we first started. You know, we were serving about 200 families, and that's basically 2 days, 3-hour windows through open air distribution. Last week, we already served over 600 families. The lines are going around the corner. And so it says two things. It says that the system is effective, but it also, like I said, it just really speaks to the increase in need. And so just really thinking about how we can reform the food industry in of itself. The thing that comes to my mind is almost reminiscent, and not trying to be provocative, but almost of the tobacco industry, and that it was the problem and the cure. And so we really need to really take this moment in light of what we have said, and my colleagues have said, how what Corona has exposed in terms of the pre-existing health conditions, and how we can really move forward in terms of health literacy, healthy food options, equitable distribution, and again, cooperative economics, where everyone is able to participate and own. And so, yeah, but those are some needs that I see.
That's very helpful. So Mark, your expertise and your vast knowledge is so appreciated here tonight. And is there, you've talked a little bit about post-COVID, what could happen in terms of a food movement, and there are obviously pockets of it. I always know that the farmers and those of us who support food stamps and SNAP, hopefully when this president is gone, it'll be even a tighter relationship in a positive way, because we always thought that was the one bipartisan bill we could get through until now, of course. But I'm wondering if there is, I don't know if you call it a food movement, as some of the questioners are, they want to know if such a food movement could be advocated for and could exist, and of course, what it could accomplish. So I know that big agriculture is a hard thing to counter, but I just want to know what we should be doing to do that, in your opinion, or to, it seems like that's one of the few ways, obvious ways to try to accomplish the fresh fruits and vegetables and the healthy Americans.
No, I think 10 years ago, we would have been talking about exclusively hunger in this situation, and we're talking about more than that. So I think that's progress. I think the recognition that there's more than one way to malnourish someone, and there's more than one way to hurt somebody by making food difficult to obtain or making good food difficult to obtain. I think that's an important step. I think another important step is to recognize that food costs money. Producing food isn't easy. Farming isn't easy. Taking care of the land isn't easy. And maybe there's a reason the word subsidies has become a dirty word. So let's use the word incentive. We incentivize the growth of food that's hurting us and hurting the land. But if we recognize that food is difficult to grow and food is difficult to get to many, many people, we have 350 million people in this country, billions in the world, that takes a lot of work. And if we recognize that this is as important as universal health care, as important as getting electricity to people, as important as helping people survive in other ways, then maybe the recognition is that we need to incentivize the production of good food and make it possible, make it a public service to get that good food to as many people as we possibly can. I think that's a political issue. And I don't think that in 2016, in 2012, in 2008, you did not have candidates talking about that stuff. This year, almost every Democratic candidate for president had a platform that had as part of his or her platform addressing agriculture and food. And the presumed candidate Biden has that as well. So I think that's really progress, and we do have to organize a food movement, continue to organize a food movement, and to apply pressure to politicians and political candidates for political office to take food more seriously and to say a food system should be a system that tries to get the best food possible into the mouths of as many people possible.
It makes perfect sense, and obviously it's a health issue. So if you're putting health and food together, maybe the people understand that they are intertwined. But for some reason, sometimes it doesn't happen like that. Commissioner, I think somebody wants to know how many people in New York City are in need of food, and I think that number has dramatically increased as we have lost our jobs. And how do you measure this? Now, I don't know that those are answerable questions, but you said you're feeding 1 million and then another 550 at the schools. That's a lot. So
Right. So we're looking at it from two perspectives. One, what's the demand coming into the system?
Yeah.
Like, who is asking for food? How much food are they asking for? What are we seeing at food pantries? And then we're also looking at the applications for SNAP benefits and for unemployment insurance. And we think that we probably are somewhere around 2.2 million people who are food insecure in the city right now. That number was about 1.2 at the beginning of this, which is sort of actually an almost sadder statement considering we were at the height of an economic expansion, and that we're still seeing many, many people who were very, very food insecure. But the other thing I would say is even our system of emergency food, sort of the pantry system, one of the things that hurt us at the beginning of this is we rely on older volunteers to staff those. We don't invest in the staffing of those broadly, and they needed to go in shelter. So I would concur that, like, we need to think about, we make investments in lots of other systems, either through government or through our collective action. And we have not made food a system that we wanted to collectively invest in. And one of the things that I think we've also allowed to happen is every program is targeted around what is the funding stream rather than what do we holistically need to be looking at for people to be healthy.
That certainly is something that's on everybody's mind. I hope it didn't take the COVID to get people to ask that question. It certainly didn't take you, but that is the question. What do we need to be healthy? So they obviously you have looked at this issue for a while. I do want to say how much we appreciate that your organization is working with small restaurants and small organizations, because we've noticed that. And you didn't just come in and say, we're going to feed people and do it from some central kitchen, even though that sounds like your name. That's not who you are. So I guess I want to sort of try to answer the commissioner's question. How do we keep ourselves, how do we get that question answered in terms of our future? How do we make food more centrally and more systemic and something that people understand is as important as our health? But obviously, I would say if we don't eat in a healthy fashion, we're not going to be healthy.
Yeah, I think it's a great question, and it's going to be a process. But I think, you know, one of the things that our founder, Chef Jose Andres, has been talking about is that we need to look at food as a national security issue. You know, when we look at national security issues, we can get funding, we can get attention, we can, you know, and we need to realize that food is at the center of that. And if we shift the framing around food, and as Mark said, you know, stop looking at it, you know, as subsidies, or, you know, and start thinking about it holistically, I think we can start to try to, you know, look at different approaches to solve some of these challenges. You know, with our work, especially, you know, we tend to come in during disasters. You know, this is a time when these are emergencies, hurricanes, wildfires, earthquakes, and the like, when the traditional systems of food access are disrupted. And one of the things that has really made us unique as an organization, and I think why we've seen there's such demand for and such need for what we're doing, is because, you know, we historically have looked at food as a logistics problem, right? Of just trying to get certain items or get calories to people who need calories, and not really thinking about the issue holistically. It's why our federal government invests in tens or hundreds of millions of MREs that are traditionally used, you know, for our soldiers in conflict, and yet have become the basic feeding source for people after disasters. No citizen of the United States should be eating an MRE, and there's no reason to do it. And so, you know, I think it's just about kind of rethinking some of those existing systems and saying, why are we doing things this way? Is there another approach? You know, in times of disaster, World Central Kitchen has shown that we can prepare fresh, healthy meals at scale, hundreds of thousands of meals a day, get them distributed to folks in need after disasters, and provide them something healthy to eat that can be uplifting during a time of crisis. And so in the course of this pandemic, it's also been very central for us to really start looking at how and what are we serving our communities? How can we make sure that we're able to get fresh meals to folks during this time? It's not just about getting food to people. It's not just about getting calories. It's about getting, you know, healthy food to people. And part of that is also kind of flipping the way we look at the problem, and not looking at, you know, families that are struggling right now as victims or as people needing help, but rather looking at them as like our neighbors with the dignity and respect of service, right? And what do they need, and how can we come to the table and serve them? Not just, we're going to give you something and take it. And so it's about listening. It's about, you know, not pitying people, but respecting people that are going through this challenging time, and then looking for solutions that can solve that problem. And so in this case for us, it really is about how do we tap into the restaurants that are out of work right now, put people back to work so they can start buying from their local suppliers, hiring you know, out of work individuals to help with deliveries and distribution. You know, kind of working within those systems that are there and that are eager to support. Because as you know, as the commissioner noted, our structure of relying on volunteers, of voluntary organizations, of you know, the past systems we're showing the weakness in that. We're showing where they start to break down. So it really is time to kind of rethink some of that, and hopefully kind of learn from it for what we approach moving forward.
Wow. All right. So Marcel, what, in terms of the, people want to know, I think, you know, young people, they are concerned about who is in the future for food, this industry. And I'm just wondering, obviously you have farmers who are aging out. I know that's an issue. And so I want to know about that issue. It was mentioned earlier about the food pantries, but you also have the farmers as an issue. How do we get more young people, both in the food industry per se, but also as farmers? Or is this an issue? I mean, I don't know. I know that I'm trying to respond to the questions and also from what I've understood from past experience. But I do think this age issue has some resonance in terms of this industry.
Well, first, thank you for asking me what the young people are thinking. No one better on this panel. So you're right. I mean, the average age of a farmer in New York is, you know, mid 50s right now. So we have a farmer population that's aging out. A lot of them are heading towards retirement and thinking about what to do with their farm. So we have a fabulous program, a farmer assistance program at Grow NYC that both trains up and coming farmers with a focus on populations that are underrepresented in the farming community, immigrants, people of color, to try and recruit them, give them the business skills that they need to become a farmer, and then help them find land to farm on. The terrific part about that program is we're unique. Once you graduate and start a farm, we can provide you access to a market, which is super important. So not only do you learn how to farm and how to run a farm, you have immediate income when you sell your first bunch of kale or whatever, even though I don't like kale, something else. So you know, it's been an incredible program that we, and kind of a model for the country. And you know, it's super important, not only that, but to help our farmers who are retiring and helping them find a place to either rent or sell their land to a farmer. And we provide assistance both from a legal perspective and other ways to help those farmers transition out of farming, and as well as helping our existing farmers, you know, increase their land access and, you know, expand their businesses so that they can be successful in a very competitive market. So it is, you know, we're seeing a great interest in folks who want to, you know, think about not doing what they're doing and try and farm. And we've been able to help, you know, hundreds of those through the training program that we provide, and, you know, be successful, because farming is a business, and you need to be both a good business person. You also need to be a good farmer, and providing those skills and training, I think, is super important and needs to be modeled across the country, so that we can get more farmers to replace the ones we currently have, because we are facing a crisis when it comes to the next generation of farmers.
Thank you. So, Reverend, I know that Mark indicated, you know, that we need to get good food to as many people as possible. And of course, the commissioner pointed out that the grocery stores are going to sell what people are going to buy, because they need to, you know, get more than that 1% margin. I work so hard to keep the grocery stores in the borough of Manhattan and across the city. So my question to you, Reverend, is how do you get folks to eat healthier? You know, Commissioner suggested we cook more often. I'm the worst one. I know exactly how to get, you know, I don't do takeout, and I cook by boiling the water, and, you know, I'm not a very good cook. But the issue is we need to work on that issue of how do we get people to eat in a more healthy fashion. Part of it is what's available in our neighborhood, but then the commissioner points out that what's available in your neighborhood is what is able to be sold. So how do you think we break this cycle? It's not easy.
Yeah, it's a complex. Again, I go back to the education. Again, really making compelling. It's like, again, with the tobacco industry, you're really showing the facts that the correlation between diet and health. You really have to have an engaging way to communicate. Like you said, everybody's used to microwave processed foods. You have Grubhub, Uber Eats. Everybody's used to this fast process. So we have to relearn some basic fundamental skills. And I believe that in this moment where we are surrounded by so much tragedy, I think that the attention, we have a window of opportunity to maximize the attention span. It has to be education. And again, it has to be accountability as well, in terms of regulating, in terms of what the quality of being sold. Again, we understand consumer drive, but there also has to be in the same way on the supply line in terms of making sure that there's healthy options available. I find that that's also an issue, even just personally in my pursuit of personal health. It's a challenge to sometimes acquire the things that you need the most, and that's going to be the most beneficial for you. And so it's not always readily accessible, but the processed food, the sugary foods, all those things are in abundance. And so I think, again, it's education, it's accessibility. It's going to take time. It's not going to be a silver bullet. It's going to take time because this is a generational systemic issue. You have generations, when you talk about EBT and SNAP benefits, when you see what people, individuals purchase with those, it's mostly sugary foods. And so there's a detoxification that has to take place physically, as well as mentally, to begin to push this in a new direction.
Thank you. So I want everybody to know, we've got about another 15 minutes. If there's a question you want to ask each other, feel free. But Mark, I just want to keep going back to this notion that you were step in the right direction. We're a long way from Michael Harrington and some of the work that was done in the 70s when I was coming up. I understand that. It just feels so hard now, maybe because of COVID. And it also feels hard because it feels like the fresh fruit and vegetables are there. We just can't get them to the communities that need them the most. And I don't know how much is big ag, how much is the cost, which you are correctly, we need to incentivize because farming is hard and we need to make sure that just like the big real estate, if I may, so industries in New York get lots of incentives, it would make sense for the people who are doing the right thing to get those incentives. So I don't know if you could take you got 2 steps in the right, at least 1 step in the right direction. And I just didn't know, how do we get to the people that the Reverend is talking about or that the commissioner is trying to feed? That's another step to get to. Do you have some suggestions about how we will get there slowly but surely?
I'll be quick because I realize that we're running short on time.
No, we're fine, Marcus. We love hearing from you, really.
Thank you. Look, I think the fundamental thing, and it's something that we can do on a local level, as well as something we can do on a national level. And one of the fundamental statements I would make is that what we want to do is disincentivize the production and the eating of food that's bad for us and bad for the environment, and incentivize the production and eating of food that's good for us and good for the environment. So a soda tax is a very good example of how you disincentivize food that's bad for us, and making double bucks or other ways of making food stamps, SNAP dollars go farther is a way of incentivizing the consumption of food that's good for us and the farming of food that's good for us. And I think if we look at that as sort of a fundamental principle, we want to encourage the eating of better food. How do we do that? That is policy. That is not something that we're going to will to happen individually. That's something we need to work collectively on. And that means better officials, better policy, more talk like this, some optimism and some hope, but a lot of diligence, I think. Diligence is really important here.
And may I add to
Please,
that?
go ahead.
One of the things when you think about this, and I am obviously very new to food in comparison to all of you, but SNAP is so limited in terms of the amount of dollars that are given that yes, you're going to buy 18 boxes of macaroni and cheese because it's really cheap and it will get you through the month. We don't actually make the SNAP benefit large enough so that you can actually buy things that are more expensive, which is fresh produce, to be able to feed yourself for the entire month. And I think the fact that we make food such a hard thing for people to get, uh, is really somewhat nonsensical, because we are an extraordinarily wealthy country. We produce an enormous amount of food. Maybe not all the right food, but we produce an enormous amount. Uh, and so I think it is policy choices. So I just want to echo what Mark was saying, that these are really policy choices that we are choosing to make, at a national level.
Right, and there's not much we can do about that on a local level. That really is a national issue, I think is what you're saying. Certainly the legislation on SNAP is. Is there something else we could do to try to improve the national situation on a local level? I don't know. Captain?
So I think that what we've done in terms of providing models sort of the healthy bucks, it's just still it's like a demonstration project. It shows that it works, but until we can get the policymakers to make it, we don't get to scale. And I think there's some other things we can do in terms of how we are thinking about our connection to our regional environment. The one thing I would say that makes New York City a little tricky on regional is all of the different ethnic neighborhoods that don't necessarily want things that are grown regionally. They have very specific food types that they want to see in their grocery stores that are often sometimes international products and sometimes from much further away. But I can tell you that when rice got tight in some Pan Asian neighborhoods, it was almost an epic crisis. During the beginning of when COVID was making it so that grocery stores were shutting down because their workers were getting sick.
So Nate, again, back to your amazing international experience. So we're not the only country, I assume, with this regional national challenge. What is there a model in another country where food is taken in a, I guess I would say, more serious manner, something that's more akin to health and to housing, and something that people pay more serious attention to?
It's hard to compare because the United States is obviously a very unique country, and a very large country, in terms of the populations that it reaches, and our incredibly diverse background. I think there are places where you are seeing more of a coordinated effort behind food and food issues. And generally that comes from long-term leadership where food has been a priority, food, the environment, the understanding that food is something that touches everything, right? I mean, I think one of our big challenges, I think now as a country, is that the United States, really kind of buckets food under agriculture, right? Like, and we look at the USDA, we look at, who runs our school feeding programs or funds them. It's the USDA. And that is a very focused, agency that's dealing with a lot of issues around agriculture. The United States does not have a Department of Food, right? And so when you look at food as an issue, food really touches everything, right? Food is about health, food is about the environment, food is about economics, so when you kind of narrow in food into, farming and what's grown, and it puts us in a situation where it makes it very difficult to prioritize it. And things like SNAP are very easily, either kind of crushed under the weight of everything else, or attempts to just kill SNAP entirely, right? Because you don't have that sort of understanding and the advocate at the federal level of the importance of food. And so I think that, as we look internationally in terms of the COVID crisis, this is food is an issue that's being faced everywhere right now because the economic effects of COVID are happening everywhere. World Center Kitchen, we've been working very heavily in Spain, and we're seeing very similar challenges where communities just don't have access to food. It's not a unique problem to the United States, but what is perhaps more unique is that we haven't yet elevated food to the importance of what it is. And in turn, it almost like we're kind of fighting this battle with like one arm behind our back, because we can't do all of the things that we could do as a country because of the way we look at and we treat food, and because those decisions that are made are not made with sort of this holistic view. So perhaps that can be something that can change. I think as Commissioner Garcia was saying, one of the greatest things I think that we could do right now is use these models that states and cities are undertaking, and use that as a way to say, this is a solution. This could be something that works, and we could implement it at a federal level and then use this moment to try to push it forward.
Thank you very much. So Marcel, not much time left, but I do feel I need to ask more about this plant-based, because so many calls have come in about it. So obviously the folks at the green market are the likely place. Is it increasing people who are eating extremely healthy, or is it hard to know from your experience at the green market? And when I say healthy, I'm really talking about plant-based.
Yeah, I think, you're seeing increased interest in eating locally and buying fresh produce from multiple parts of society for different reasons. I think you have seniors who are interested in health reasons and other reasons. You have, I think, a lot of, millennials, for lack of a better phrase, who have disposable income and are willing to spend it on food and want to actually make real choices where their money goes, and support regional agriculture and small farmers. And they're doing that for both health and taste and political reasons. And I think that's terrific. We have a food box program in Bed-Stuy that now is seeing, the highest levels of purchasing we've seen in that program. So, as I think the food outlets have restricted and the number of restaurants have closed or are not operating, people are cooking at home and really trying to put their money where their mouth is, literally. They may have gone to a restaurant that was a locavore restaurant and spent their money in that way, and now they can't do that, so they're trying to recreate that on their own at home, which is terrific. And just jumping off subject a little bit, we've been talking about national change, and it should be pointed out that Catherine Garcia is not just the commissioner of Department of Sanitation; she is the city's food czar. Which is a title that didn't exist before that, and I hope continues in some way when it comes to supporting local agriculture and purchasing of local product and providing access to food. We do have a food policy office in New York City, which we didn't have years ago. So there has been change on a local level. Now that just needs to be brought to the national level. And I think the next generation is going to do that, because I think they are really committed to understanding where their food comes from, who produces it, and spending what it takes to make sure that that food is grown in a sustainable manner and is supporting regional agriculture. So I think it's terrific, and I think this movement is only continue to grow.
I totally agree about the great news. It was all positive. Reverend, just a final comment. I must admit, I know that you're on the 125th Street bid, and that you and I are both supporters of a lot of the Harlem restaurants, small mom and pops. Do you see their future in post-COVID, and what would they be needing in terms of this very challenging time?
I think that definitely there's a tremendous need and opportunity. I think that, again, as we pivot toward the need, we will find sustainability. I think that many of the restaurants are already doing good work. You see them distributing food, preparing food. Again, if we can create more of a demand, increase the quality and then also connect them to the grassroots communities and networks where those foods can be reached. I think there's a unique opportunity in Harlem, just given our unique destination and the culture of commerce that already exists.
Thank you very much. I have to say, as somebody who's moderated a lot of panels, this has been phenomenal. And I want to thank Columbia University because they're also doing a food relief fund. You can find out about it, neighbors.columbia.edu/feedingnyc. I want to thank Mark Bitton, Catherine Garcia, Nate Book, Marcel Vanoy, and certainly Reverend Maurice Winley for understanding this really important issue and bringing it to YouTube and to New Yorkers in such a prolific and very inspirational way. And there's a lot of good news, even in this horrible, horrible pandemic. Thank you very much. And thank you, Columbia University Mailman School of Public Health, for being our sponsor tonight. Good night.
Thank you.
Thank you.
Thank you so much, everybody.